Okay, we'll just wait like maybe one other minute or two. We've got a lot of people on. We'll just give it another minute or two and then we'll get started.
Good afternoon.
Good afternoon. Okay, let's get started. I want to thank everybody for being here today for our Business Leaders Roundtable. It is our first weekend that we've been in phase one, and I will tell you that I did go to South Park Mall on Saturday and did walk around a little bit, but I will tell you that none of the stores were open. So I would say maybe about 10 or 12 stores were open, not very many at all. There was very little traffic. But I did go to Dick's Sporting Goods and they were open, and I bought a new set of golf clubs. So overall, it was a banner weekend for me.
Congratulations.
I was very excited about that. But anyway, other than that, I think
Hey,
things
Gina, were people wearing masks?
You know, not really very many. And we've been getting a lot of feedback from people about not seeing as many people as they would like to see wearing face coverings when they leave their home. And Gibby and I talked about that a little bit this morning about how we need to continue to reiterate the message around how important it is for people to wear them when they leave their homes. And earlier today as well, my chairman and I actually had a call with Senator Tillis, who, you know, is encouraging businesses to take the position of no business, no mask, no service. And that's certainly something I told him that I would bring up to this group as well, in terms of, we couldn't certainly mandate it, but having a policy for businesses saying that if you don't wear a mask, we're not going to serve you, might be a way to encourage people to put face coverings on when they leave their home. So something for us to consider as we move forward. Before we move into the content, did anybody have any other surveillance from over the weekend they'd like to share with the group? Yeah.
I also feel that one of my questions here was who is training the employers? Because we're asking the employers to train the employees, but the other question is if neither the business nor the customers are following the guidelines, who would be enforcing the guidelines? I went to supermarkets where nobody's really keeping track of how many people are going in or out, or whether they have a mask or not, and it's worrisome. It was very worrisome how relaxed everybody is outside.
Yeah, well, the guidelines around masks, and Gibby can certainly chime in, or Reynard, is that's really a recommendation. It's not a mandate. But how do we enforce the message and get people to understand how important it is? And I don't know if, Gibby, if you thought any more about how we might be doing that.
I think we just got to continue to reinforce that and really encourage leaders in our community to model it. I think that will help. If I saw someone here that had one hanging around their neck just a minute ago, I'm not sure who that was. But if our leaders are, there you go. The leaders are wearing masks, that will help send that message. And it may be that we look at some opportunities to do some short clips of leaders in the community speaking to wearing masks as well. But I do think businesses have the ability to help us encourage this, even though at this point we're not mandating.
So Gibby,
Hey, Dana, this is Mark.
Go ahead, Mark.
Thank you. So I want to echo that the wearing a mask seems to be an issue from what I observed as well. In the toolkit that came out, I think it was there's a great sign in there that says "Caution: No entry without a face mask." So if we can encourage our business owners to really put that sign up. That will help us reinforce if we can get that message up and get the buy-in from all of our business owners, or as many as possible.
That's
Yeah,
great.
this is Sam Judd. I think one good example of that, I bought some running shoes this weekend at the running company at Myers Park, and I think it's a slight distinction, but instead of saying we require you to wear a mask, it said we're wearing masks and ask that you do too. The nuance, but it just felt a little bit more polite than saying no mask, no service.
Mm-hmm. Yeah.
This is Pat Rogers. As you know,
Yeah.
we've,
Pat,
this is Pat Rogers, Tina. You know, we've been up and operating from the first day. We haven't closed all the project sites, so that's been very challenging. One thing we found, you have to wear a face covering to be on any of our project sites in our offices. And one thing we found on the outside, and one thing you might want to consider, is people who are working outside, the mask creates safety glasses to team up, to fog up. So we've ordered and have dispensed safety glasses that are fog resistant. So that is something that if you have an outside business, you may confront. So you need to know that ahead of time and maybe be prepared for that.
okay, that's helpful. That's helpful.
Hi, Deanna. This is Uday here from Carolina Business Alliance.
Hi.
Um, so we have like a couple of Indian groceries chains that have implemented this no mask, no service kind of a thing, and they're also asking people to wear gloves. But we want to make sure, like by asking people, and kind of stating that openly, will not lead to any frivolous, legal implications, right? I mean, is there anything that is there any verbiage that we can safely use and that the county can provide, that we can, go ahead and share it with the group, with our group?
What exactly did you ask me for? I didn't hear you.
Like,
Sorry.
so, I mean, if we state that, there is no surveys, like if you're not wearing the mask, no surveys, and somebody can go and press charges, right, legally. Like, I don't know if, because it's not mandatory from the county or city or the state, right? I mean, this is something that we are saying like as a precautionary measure, right? But if somebody is going and implementing that to just protect themselves and their employees, if people gonna go and say like this is kind of and press legal charges because they're not providing the services.
Because they're being
Uh,
refused to be able to enter the business, and if there's legal implications for doing that. We
correct.
can go back and
Correct.
check that. I think that's a good point. The other thing that actually Senator Tillis raised today was this notion of organizations that are being sued because people have indicated that they were exposed in a particular business, and because they weren't taking necessary safety precautions. So I think it's uncharted territory, but we can certainly go back and see what the legal implications are of that. But I think that's a really good question and something we should
Because
definitely keep in
a
mind.
couple of cases have come to our organization, to our members as well, similar legal charges that have been leveled.
Okay.
So because there are some attorneys that are taking, these as fraudulent attorneys, right, that are trying to use this as a case and trying to press charges and extort money from the small businesses that doesn't have means for legal discourse.
Okay.
So, Dina, this is Andy. I with the Retail Merchants Association. I would also sort of just give you two other perspectives on that from what I dealt with this weekend. One, you saw this with Costco last weekend when they developed a policy that no mask, no service, and they immediately got boycotted by a number of people. Now, a lot of people decided to go there, but they also had a lot of people that went the other direction right out of the gate. And with some of the smaller businesses, especially, just getting back open and having really bad economic times, some of them are not going to want to get put in that position of no mask, no service, or no facial covering, no service. And then I just point that piece out. I also, the one boutique I went to this weekend where I live outside of Raleigh, there were two 17-year-old clerks working the area, and most of the people had facial coverings in this boutique that I was in buying my wife a Mother's Day present, but there were a couple that didn't. And, I put myself in the place of a 17-year-old kid telling, a 45-year-old man, you can't come in this door without the facial covering.
Yeah.
Which we just want to make sure that we're not putting people, in a bad place, especially some of the youth that are working as we start into the summer.
Yeah, no, that's a great point. And so I think it's about how do we continue to put this message out there that this is a good practice and that we need to continue to encourage people to, to use facial coverings when they go out. And we can think more about
Dina,
messaging.
Dina, this is Mohammed Janatian.
Yes,
How are you?
I'm good. How are you, Mohammed?
I am doing fine. I wanted to let you know that as we talked about this last week, we all in the business community need to go out there and communicate with other businesses. And the information that was sent to us is great. And we all need to work together and get that information in the hands of everybody. Particularly, obviously with the Charlotte Regional Business Alliance, with the Latin American Chamber of Commerce, with Visit Charlotte, and other Chamber of Commerces in Mecklenburg County. We do need to have this information that we can send to all of our members. But I don't mind telling you that each one of us has members. All of us are struggling right now because of our membership and considering the fact that none of us can qualify for any stimulus plans. But I have hesitation, and I don't think others would do that because we have put a lot of information in this material that we received that is recommending people that are only members of the CRBA. Would definitely, I hope nobody takes it personal. But we need to do something that we all can send it out, because if I send something to my members and they're not included in that list, they're not going to be happy with me. And but overall, I would tell you that the material that you put together, it creates some clear guidelines for a lot of people that don't know what all they need to know, what the guidelines are. And I hope that we can make everything a little bit more neutral. We can get everybody to go to everyone's website. I know in my case with the Hospitality and Tourism Alliance, I have been actually promoting a lot of our organizations that do disinfecting and provide PPE materials. And that has been going on for a while. And definitely want to hear from Lucia and others about their opinion about that. I just want to have something that it would be neutral enough that all of us can go out there and put it out there.
So are you saying that the toolkit is too geared toward retailers and small business?
No, I'm talking about the part that we are recommending companies that are offering sanitizing, the safety catalogs that we have, the PPE materials that we have. We need to be cautious about not only recommending people that are members of one organization versus others.
Yeah, and this is Jennifer Weber. So it's a great point. And so to the extent that, this can be a living, breathing resource for small to medium-sized businesses. And to the extent that we want to add other services, the whole intent there was to at least have a starting place for people to go if they need printing services, if they need sanitation services, but also to make sure they're going to those businesses locally and they're helping local businesses. And so if there are other ones that need to be added to that list, that's easy to do. Just you can let me know and we can get those things added.
And I think the other
but Jennifer, I
think
the point that I'm also
I think the point to just say one thing, it's not that they're being recommended, it's just the toolkit's really designed for a one-stop shop so people can go to a place and get all the information they need. They're not designed to be recommendations. And maybe we need to put some kind of qualifier on that.
Yeah, we can do that.
Yeah. So go ahead, Mohammed.
But I think, Dina, the point that I'm bringing up, and I'm sure that applies to, the Lake Norman Chamber of Commerce, the Matthews Chamber of Commerce, Visit Charlotte, Latin American Chamber of Commerce, the ones that are members of our organization, and they are, helping us to stay in business. They expect us to go out there, and when we communicate with the rest of our membership, they want us to work on their behalf, and that's the area that I'm talking about. I know that for all intents and purposes, everybody can go get whatever the information that they want, but we're all in the business, and as is basically banks competing with each other and having to protect their own customers. We're also in the same situation. I just want to be able to, for all of us, and I may be the only one that would say something like that, but I want to be able to send that to everybody out there without alienating any of my members or promoting somebody who's not part of my organization.
So do you have a recommendation then for the group, Mohammed?
I would like to. I think all of us have started having a page on our website that is promoting these services. I would like for us to create a situation where we get everybody to go to the website of any membership organization that they belong to and get that information.
Okay,
I think we're telling people what it is they need to have as far as access is concerned. We just need to just leave that vague enough where they would go to the organization that they're members of.
So what I hear you saying is that instead of listing those individual businesses, we should just put links to the various chambers and membership organizations instead.
Absolutely. Okay.
Well, we could do that, or we could leave those there, but also add the links to the membership organizations.
I think that would be fine, and I'm definitely not being protective, but I also do know that all of us, we're in the same boat together, and we're trying to do everything that we can to do a better job of promoting our specific members. And it would be, a lot of people wouldn't be doing that. A lot of people wouldn't even say that they wouldn't do that, but probably wouldn't feel comfortable going out there, getting the information and promoting all these other organizations that may not be a part of their membership group.
Okay, well, we'll go back and look more at that section and see what we can do to accommodate your concerns. But thank you for bringing that up. I appreciate that. So now that we're on the topic of the toolkit, I do want to say what I said in my email and thank Jennifer Weber, who did, she did all the work on that toolkit, and I really appreciate her assistance. And then, of course, Ray Ward, who made it look so beautiful. And I know that Carol Lovin and Jesse Curitan also added some information to the toolkit. So we feel really good about it. I didn't know if anybody had any feedback about it, anything you think we might have missed, or things we need to add or change. I know we didn't give you a whole lot of time to look at it, but we are going to go ahead and we're going to start to push it out. We're going to consolidate some stuff and, make it all one document. But it's going to live. The links will live on our website at Mecklenburg County. So when you click all of the links, it's all being hosted there. So you'll be able to click and go. Jennifer, do you want to talk a little bit about how you put all that together so people understand the content?
Sure, absolutely. So our goal with this toolkit was to make it a standalone document where it consolidates a lot of the really helpful information that's out there, and it's real easy to access and understand. You wouldn't need somebody to walk you through it, in other words. And so it gives general guidelines. How do you calculate your emergency maximum occupancy? It goes through social distancing, cleaning and disinfection guidance, and then a number of different techniques, including wearing face masks to reduce the spread and mitigate transmission. We also wanted to have ready to print signage. So if a small business just says, hey, I just want to download this is perfect. I'll print it out on my printer here, laminate it, and we're good to go. We offered, Ray Ward actually developed this signage that you can download really easily. It's in both English and in Spanish. And then we had a whole catalog of other alternatives, but the intent was for it to be kind of a one-stop shop of all of the really helpful guidance that's out there. Andy, a lot of the information that you had was helpful. I really tried not to make it too terribly industry specific, so that it would feel like it's useful to all businesses. The one other thing I would note is I did highlight and bold the fact that, hey, all of these guidelines are important, but the most important thing is an enforcement of guidelines among customers and employees. That's the most critical aspect of this. And so that's pointed out in this document. So it's ready to go. Welcome your feedback if there's ways that we can make it more useful to all of you. And for those of you who have membership bases, just let me know what else we can do to make it helpful. We're happy to improve it, but I think time is of the essence since so many businesses are in the process of reopening.
Hey, Dina, this is Mark. I just want to say that I love the tool. I think it's great. Like I said at the top, one of the things that I'd like us to consider would be adding a slide potentially for symptoms. I think that may be useful in some areas so people are aware of potential symptoms to look out for and can reinforce those.
That's awesome. That's a great idea. Great suggestion.
We can add that.
Hey, Dina, this is Reynard. I was just going to jump in back on the face coverings for a quick second.
Sure.
The one thing that retailers can do that I think would be incredibly helpful for us is, in addition to the signage, is to also make face coverings available for purchase in your retail location to make sure that people have access to them, and not just assume that me not wearing it doesn't mean I'm just not choosing not to do that.
That's a great suggestion, Reynard. Thank you. Other questions about the toolkit?
This is not a question, but a suggestion. I've noticed that some of these flyers are also consistent with the CDC, and perhaps Jennifer, if you could perhaps add a link directly to the CDC website, because some of these flyers are also in several different languages, not just English and Spanish, but
They are
in a lot of Asian and European languages. So perhaps those business owners can benefit from that. I mean, that link directly.
It's a great suggestion. We do have a link on slide 19. It says CDC resources for business and workplaces. It takes you right to the CDC's website. And so that should
if you could point out that it's for additional languages, because sometimes
got it. I can do that. We'll add that. That's a great call out.
Sometimes browsing through those pages to get to the language where you need to have access to is the language barrier is what creates the difficulty.
We'll add that. It's a good call out because there are some great resources on that website from the CDC. Got it.
Jennifer, on slide 6, the numbers as far as capacity and number of customers per square feet are inaccurate.
Oh, they are? Okay.
Yeah.
Okay, so send me what I thought I took this right from your materials, but you just send me what is accurate if you wouldn't mind, and I can change it.
Okay, be glad to.
I think retailers are at 50% now. I noticed that too.
Oh, okay.
It's 50% and 12 per 1,000 instead of 10 per 1,000.
Okay. Was that in the webcast you sent me, Andy? I can just pull it from there.
Yes, ma'am.
Okay, I'll just go to your webcast then.
Dina, this is Michael. I just wanted to say how well done I thought it was and now is improved by the collective wisdom of this group. This came up as an idea from the group in one of our last meetings, and now here it is. And a lot of people contributed to it, and I just wanted to be witness to saying that this is why you convene this group together and how effective it can be to serve the community. So, bravo.
Thanks, Michael. I appreciate that. Other feedback? I know we didn't give you a whole lot of time to look at it, but if you want to take a look at it over the next day, we're going to make these changes and we're going to push it out because we want to get it out. But we can always make some slight revisions. So if there's other things that you think need to be in here, we can certainly go ahead and make some revisions and continue to push it out. But again, great job by Jennifer and the group. It really really came out great.
It was a good team effort.
So thank you for that. We'll continue to work on it. And the next item on our agenda is around training. And again, Jennifer did some amazing work around this that I wanted her to present to the group about some training opportunities that she's been working on for small businesses in the community. So I'm going to pass it to her.
Absolutely. Thank you, Dina. So I actually approached a training partner that has a pretty sizable relationship with Lowe's, and I asked them if they would be willing to make their training assets available to small and medium-sized businesses. And they actually are willing to do that. The name of the company is called Exonify. It's web-based, mobilely enabled training. So it just struck me as something that might be really important for some of these businesses who don't necessarily have the resources to train their employees like large companies do. And so we're scheduling a call. It's probably going to be tomorrow or Wednesday with a small group of folks. Andy will be involved in this. I don't know if Sarah's on the call, but she'll be from Girl Tribe. She'll be involved in it. And then Thomas, who heads up the Small Business Administration locally. And so what it will be basically is just really great training assets. It'll have safety training. There's actually going to have, there's a lot of anxiety and mental health issues at a time like this. It'll have, you'll have access to resources like that. But most importantly, what I want to create is I want to get feedback on which training modules will be most helpful to the small business community. And then we'll be able to take this website live, and people will just have to go in and register, and they can take various training modules. I think this is an important part. A part of this toolkit is building confidence and credibility for your customers. I think customers going into businesses knowing that owners have taken all necessary precautions, but they're also doing something to train their people is a big part of that, instilling confidence of customers. And so, Dina, that's going to be ready by the end of this week, no later than a week from today. That'll all be ready to go. And it can serve as an ongoing resource to small businesses.
Yes, again, I think, again, that's a nice complement to the toolkit is being able to provide training. And I think it lets us get information out to so many more businesses. And again, gives them just another resource to make sure they're safe, their customers safe. And so again, I want to thank Jennifer for all of her efforts on that. And we'll provide information on what that looks like once it gets built out a little bit. But just again, another tool in the toolbox to try to make sure that people are doing the right thing in the community. Does anybody have any questions about the training component of what we're putting together? Any suggestions that we might want to think about as we pull that together?
I would like to ask, is there an opportunity perhaps to do like a YouTube tutorial of no more than 2 or 3 minutes? Sometimes having another Zoom webinar is not convenient for everybody. And a lot of our small businesses are lacking time to be able to read and gather all this information. Perhaps some tutorials that they could review and then maybe share with their employees could be helpful.
Okay.
I don't know how feasible or how quickly this could be developed.
Okay. Well, it's the kind of site that enables that. So there's actually a place where you can upload videos. And so what I'll ask them to do is to make sure that we've got real clear instructions and tutorials as a part of it. So that's another good call out, and we'll make sure we ask them about this on this call that we're going to have. Thank you.
And I think I said Zoom, but I meant YouTube. Did I say YouTube? I meant to say YouTube. Something like a video like that. Just what you said. Yeah. Okay. Good.
That's what you said. Yep.
Dina, this is Michael. I don't know if this is a training issue, but I did want to, I guess it's the best time to bring it up. And correct me if I'm wrong. When I read the statistics, it seems that the large number of folks getting COVID-19 are in that 29 to 50-year-old group, but the people that are dying are in the older group. So if I'm right about that, how do we get a sense out there that, and the people in the 29 to 50 are not dying, if I'm correct, how do we get the sense out there that this is not just about protecting yourself, it's about protecting other people in how you act. I always think about everything from a philanthropic and humanitarian sense, but how do we get a culture going of these things are as much about protecting someone else as it is about protecting you, particularly those that are our oldest generation? I don't know where to go with that, but I thought I'd ask the question.
Well, I think, again, it's around how we message it. And I think it might be, maybe that's something that we can talk to Ray Ward about, is how to maybe come up with some creative ideas. And then how do we push those out? And I can talk to our public information team about how we do that. But maybe that's something we can ask Jennifer Appleby to think about as something that we need to start doing. Because it is all about messaging, and it's all about, messaging to the right populations. And, that's really in her wheelhouse.
I can follow up with her on that.
Okay. All right. Terrific. Other
I was
questions?
right about this. I was right about the statistics, wasn't I? Isn't that what's happening?
Gibby, that's correct, I think, isn't it? She's nodding. I'm saying she's nodding because there's a lot of people listening on YouTube, so I want to make sure they
Yes,
they know how you responded to that question.
absolutely.
Okay, terrific. So that's where we are with components of the work so far, and we'll continue to work on that. And I'm going to talk a little bit about that when we get to the next step section of the agenda. But as we've always promised you, we are going to talk to you and keep the data, the Mecklenburg County data, in front of this group. And so I'm going to turn the next two items over to Gibby. One is to, again, review where we are with the Mecklenburg County data, and then to talk through with this group where we are on our testing plan, because as you know, testing is a huge component of being able to reopen safely. And so she's been working on a testing plan for Mecklenburg County, and I want her to go over that with you, respond to any questions, concerns, or suggestions you may have around that. So with that, I will turn it over to you.
Good afternoon, everyone. So as of today, we have 2,129 confirmed cases of COVID-19 in Mecklenburg County. There have been 63 deaths, and we have 12 long-term care facilities that are currently in outbreak status. As was mentioned, 3 out of every 4 cases are in individuals less than 60 years of age. 40% of those have been Black, and 25% have been Hispanic. Our Hispanic numbers have been growing fairly rapidly over the last week or so. And there's probably a couple of reasons for that. One is there's been some targeted testing in communities that have less access to testing. And some of those communities have been in where Hispanics live. Many of our Hispanic population here work in essential jobs where it's probably less possible for them to social distance and stay home. And we also see some pre-existing disparities in that population. So we're continuing to watch that carefully. One thing to note, though, is that 90% of the cases among Hispanics are in individuals less than 60. So it's a younger population than what we're seeing in population as a whole. 1 in 6 individuals has been hospitalized for COVID-19. And of all of our deaths, only 4 have been in individuals less than 60, and those were in the 50s in terms of age. 66% of our deaths have been among whites. That number has increased fairly significantly over the last couple of weeks, and a good reason for that is that many of those deaths have been among individuals who were in long-term care facilities, and they are predominantly populated with white individuals. The things that we are tracking right now in terms of looking at how we're doing with our social distancing and opening up businesses and those sorts of things, we are seeing increase in the number of positive tests. We expect to do that because we're doing more testing. But when we look at the percent positives, so the percent of positive tests over the total number of tests done, we're at least stable with that, if not seeing a slight decrease in that percentage. Right now, as of late last week, we were seeing about 7.5%. And nationally, the intent is to be below 10%. So I think we're stabilized there. And our hospitalizations are the other main trend that we're watching, and we've seen a slight decrease in hospitalizations as well. So as of now, our data has trended in the direction that we wanted it to trend. That allowed us to open up some with our businesses in the community. We will not see the full impact of what has happened over the last weekend and will happen over the next couple of weeks for a week to 2 weeks. It takes that long for us to see individuals potentially becoming infected and seeing if our numbers rise even more. So we'll continue to watch these trends and keep you posted on what we're seeing there. But right now, we feel we're where we need to be. The manager mentioned a testing strategy. We've gotten some direction from the state. As you may have heard, the governor has put a number out there of the number of tests he'd like to see in the state of North Carolina over the next 30 days. And basically what they're saying is on a county level, they'd like to see us test 5% of our population in the next 30 days. That translates for us into about 12,950 tests a week. We've been averaging, and that comes to about 1,850 tests a day. We've been averaging between 700 and 1,000 a day in Mecklenburg County. So what we have done is put together a plan that we think will help us increase that number, but also making sure that the folks who need the testing the most continue to have access to it. So the plan, the strategy actually has 3 priority groups. The first priority group is a group that we're already testing, and these are the individuals with moderate to severe symptoms, individuals with symptoms who are also 65 and older, may have a serious chronic health condition or weakened immune system, are healthcare workers, live or work in congregate settings such as long-term care facilities, shelters, or prisons, or our first responders. But we're also looking at individuals identified by the health department through a cluster or contact investigation and prioritized to receive testing. So an example of that is if in one of your businesses, all of a sudden you had 3 or 4 of your employees test positive, we might very well ask to have everyone tested that works in your facility. Priority group number 2 that we're implementing over the next 2 weeks as we're implementing phase 1 will include individuals with mild symptoms, including children, individuals with a known medium to high risk exposure. So not necessarily symptoms, but we know that they've been exposed. And we're specifically looking at those in healthcare facilities, congregate living settings, and first responders again. And as the hospitals open up for medical procedures, we're looking, they're testing these individuals before they go to elective surgery. And then we get to priority group number 3, which will will work towards implementation of this priority group, but we're looking at later in the 2-week period. And those are individuals who support critical infrastructure, such as workers in grocery stores, pharmacies, childcare facilities, restaurants, gas stations, public utilities, factories, and for areas where sanitation is prioritized, and if there's a reason to refer from a public health reason again. And at this point, we may start looking to do some testing from a sentinel standpoint so that we can look at surveillance in our community and to continue to better understand what we have going on here. So those are the 3 priority groups that we're looking at this point in time. We're working with both hospital systems as well as some of our other community partners who are doing some limited testing to expand their capacity. We're working with several laboratories in the area to make sure that we've got sufficient laboratory supplies to be able to do this testing. So at this point, we're we've reached a couple of days in the last 2 weeks where the hospital systems tested close to the 1,800 a day, but those were outliers. So we will continue to look to expand this testing availability and make sure, again, that we're testing the ones who have to have it the most. So that's where we are at this point, and I'll be happy to answer any questions that you may have.
Any questions for Gibby about testing? Gibby, can you talk? Yeah, go ahead.
This is Mohammed. I have a comment in regards to what she just said and what Michael brought up about young people not worrying about, getting the virus. It would be nice for us to have a public relation campaign that we use billboards and all kinds of signages that simply says, please help protect our vulnerable population by wearing face covering. Because if we want to help flatten the curve and do what we need to do, as we all have mentioned, and I know Gibby is interested in doing that, it would be nice in a more subtle way of getting a lot of young people to wear face masks and covering.
We're gonna follow up with Jennifer Appleby about what we need to do to get that message out and what's the most effective way to do it. But yeah, we absolutely agree that that needs to happen, and we'll figure out a good way to do that.
I obviously want to echo Mohammed, myself, and I don't know, Dina, because of the gravity of this, maybe there's some philanthropy that could help in finding a way to help finance such a campaign if a county doesn't have those resources. But okay. I'm all over this with Mohammed.
Okay. I have a question. This is Dr. Shante in regards to the testing and testing priorities. Where do volunteers, especially those feeding or directly feeding and interacting with folks, especially the homeless, fall into those priority guidelines? I live uptown, so I see the volunteer efforts that are going on. I think it's called The Wall uptown, and there is a huge amount of people out there every single day. And that's become a bit of a concern for me as somebody who just lives in this neighborhood.
That's a good question. I see our volunteers, especially those that are doing that kind of work, sort of falling into that critical infrastructure. Again, we are watching our homeless population very carefully in terms of individuals testing positive in that population, and that could also trigger concerns for the volunteers as well. So we will stay tuned into that. But I do think that they fit into potentially priority group 2, but definitely in 3.
Gibby, could you talk a little bit about why our community doesn't have sort of the drive-up testing from like a Walgreens or CVS that we see in other communities? Is there a way for us to access that at all?
They're part of the groupings that we're having conversations with about potentially expanding testing in the community. It appears that some of those types of facilities are focused more in communities that don't have much testing at all. We are doing more testing here. I think last week we determined that between the 2 hospital systems alone, we tested about 3.5% of our population already, which is much higher than many of the other counties. But we're looking at working with our FQHCs, as well as with some of the different businesses who could do some of that testing as well over the next couple of weeks to get that geared up so we can accomplish the number of tests that we feel like we need to do in Mecklenburg.
Okay, thank you. The other thing is, when we started to see the increase in the positives in the African-American community, we did the toolkit for the community and the pastors to try to get information out to that community. What are we doing around the Hispanic community? Do we have any outreach plans? Because if this is a population where we're going to continue to see positives, what do we need to do to be proactive in that regard?
Well, thank you for bringing that up, because I didn't mention the fact that we do have a toolkit on our website in Spanish that is available for anyone to use, that educates. There are posters, there's things that you can use in social media, infographics. There's a number of different things on that site. So please take full advantage of that. We're working with a number of the folks in the community that we interface with that work specifically with the Latino community to make sure they're getting the information and the word out as well. And we've done a number of interviews on some of the Spanish-speaking radio stations and Telemundo here in the county as well. The other thing to know is that Atrium, with their, not calling it mobile units, their roving testing sites, are spending a good bit of time in a number of those communities as well. And so they will continue to focus on those hotspots to make sure that testing is available there. So,
Dina and Gibby, it's Carol, and just wanted to thank you, Gibby, for all this work on the plan, and basically to tell the rest of the group too that the priorities you set with the health system's involvement, these are very consistent with the way we've been testing to get to that 2.5% or so, and
absolutely.
also to say, because Dina, I think you asked about CVS and others. Right now, whoever can help with this testing is great. We also, I know Atrium has 7 sites up, and you drive through to get your testing done, as well as the 2 roving units that we're using. So we want to just work collectively with the entire community, because all hands on deck right now is what this is going to take. So thank you.
Absolutely.
Gibby.
Thank you, Carol.
Thanks, Carol.
Dina, this is Rocio Gonzalez with the Latin American Chamber of Commerce of Charlotte. I want to thank the county, the city, and also Atrium and Novan Health for sharing their information. There is a large coalition of community partners that support the Latino community, and I just would say that just one way to reach out to the community is not enough. So I appreciate the fact that you are investing your funds in reaching out to the community via television and radio, as well as newspapers. I think the digital divide is still leaving a lot of the community behind. I feel that perhaps supporting and printing some of these flyers in Spanish would be very helpful, so that we can make them available to the small businesses and share the information a little bit more. I want to share that with Novan Health, we have offered the big parking lot that we have on Scaly Bark and South Boulevard as one of their pop-up locations to provide free masks and information. I would love to invite Atrium to do the same. And I would like to say that I see a lot of efforts concentrated on the Central Avenue, Albemarle Road, University area. Let's not forget that the South Boulevard, Arrowwood, Nation Sport area has a large concentration of Latino community, which is the leg of the crescent. And also there's a large concentration located by Park Road and 51 Pineville, that due to the zip code of the 28277 and 28270, which is sort of the Ballantyne area, it's really not believed to be an area with a high concentration, but it is. So I'll be happy to serve as a connection to help you with the larger outreach and to spread the information with the rest of the community partners. Okay.
Great. Thank you.
Thanks, Rocio. So we'll be in touch with you to figure out the best way to get that information out to the Latino community, because we really want to make sure we get it out in the right places and quickly. So we'll follow up with you on that. And I appreciate you willing to help.
Thanks.
Terrific. Other questions or concerns or ideas about how we're approaching any of this at this point? Terrific. Okay, so the next thing I wanted to talk about is kind of where we go from here, and I wanted to get some feedback from the group. I think the toolkit that we've done is fantastic, and I'm wondering if we should now start to focus on other sectors of our economy, because, I have this portal where the business community can ask me questions, and I've gotten questions from fitness facilities as well as personal care facilities, as well as food and beverage, about guidance for those types of businesses. And, you know, as we get to phase two, those businesses in some form or fashion are going to be able to reopen their doors. And does this group want us to take a stab at trying to put together guidance for those types of businesses? So when we get to phase two, we have guidance that might be available for them to be able to access and to start to reopen safely when we get to that point. Because I see us being really effective at looking at different industry sectors and providing that type of guidance. And so I wanted to see what the group felt about that as an appropriate next step, or if there's other things that we need to be thinking about and that this group can work on. I'd like to hear that as well.
Dina, this is Mohammed Janatian, and obviously we would love to have any information that you can put out there for restaurants and bars. I'm hoping that with the phase two, they slowly would start opening. Any information that they need as far as everything that we've talked about, it would be helpful, and we'd be happy to get that in the hands of everyone. Also, know that more than likely going towards the future, a lot more of these restaurants have to think more about outdoor dining. And Dina, whatever that can be done to make it easier on businesses to make that happen, and a lot of it relates back to building standards. I would love for you to start thinking about that too also.
Okay, great.
I wouldn't mind making sure that we cover places of worship, especially as it relates. The Black Chamber of Commerce is getting a ton of questions specific to places of worship and what they should and shouldn't be doing, which phase they actually are included in, and how they should operate. So that's going to be extremely helpful.
Okay, that's great, Dr. Williams. Thank you for that. That's good. That's a good point. We were talking about that this morning, actually, as well as how there's going to be there's been a lot of interest in that. So I've definitely added that to the list.
Dina,
Yep.
Dina, this is Michael Smith. One of the things that we've seen in other communities as they've begun to open their bars and restaurants is how do we utilize, how do we extend their rights? So one of the ideas being off-premise ABC laws. And I know that's something that we would have to work with the state, but we've had ABC laws that have been worth revisiting. This may give us an opportunity, even if we only do it for a period of time that sunsets, to allow you to be able to take it out into the public right away, or be able to buy and take it home, are things that I think are worth considering. And then we've even seen in some places where you can take your food from the restaurant and your drinks and go into like a county park. And I know that's something that's been a restriction for good reasons, but as we're trying to allow these businesses to be able to sell, take stuff off premise and create more locations for people to enjoy it, this commerce, these may be things that are worth investigating.
So do you have any list of locations I could look up that are doing that so we can pull from some of those ideas, or can you email them to me and we can take a look?
I'll reach out offline. Yep.
Thanks. Other thoughts about what we're thinking?
And Dina, this is Mohammed, and I think as we get ready for the next phases, I would like for us to start thinking about some of these businesses that are particularly located right on the county line or state line. Somewhere down the road, I know that I had a conversation with the general manager of Carowinds, and she would like to know what the future holds for them. And somewhere down the road, we need to have some conversations about, particularly in their case, the fact that half of their property is in South Carolina, half of it is in North Carolina, Mecklenburg County. I didn't know if you had started doing any thinking about, that business.
Actually, we haven't, but I suspect that would be, and Gibby could help me here as well. That sounds like more of a phase 3, when we can do more of mass gatherings, like when we're able to do things like football and basketball and some of these larger concerts. But we can go back and research that, and we can certainly reach out maybe to some folks at the state and see what they're thinking, because, if South Carolina is going to let them open, but North Carolina won't, I think it does create some issues that wouldn't apply to many or all other businesses. So we can do some follow-up work on that and see what we can find out. So that's a good point.
Thank you.
Other questions or things that we should be thinking about? We have lots of homework.
Hey, I just want to jump in. As far as small business is concerned, the service industries, nail salons, hair salons, I've been seeing a lot of questions about that in my own circles. And so just to make sure that they are also being taken care of, considering they've been hit, I'd say pretty hard during all this.
Yeah, those are, I referenced that when I meant personal care, but yes.
Oh,
salons,
great. Yeah, perfect.
yeah,
Okay.
yeah, but yes, absolutely. Okay. So we'll go back and we'll get to work on these things, and we'll start to pull some things together that we'll push out to the group. We'll follow up on all your suggestions about our toolkit at this point that you've given us, and we'll make those changes and we'll push that back out. We will talk to Ray Ward about potential messaging around face coverings and how we can get that out into the community. We'll continue our work. Thank you, Rocio, again, for helping us with the Latino community. We'll continue that outreach. And we'll have another meeting. I think I made a mistake when I scheduled this one. I forgot to actually invite all of you, so I'll make sure I don't do that a second time. But again, any other questions or things that we should be thinking about as we move forward from here? Okay.
I have a quick question. This is Rocio. I see that the information is up to May 6th. When will the next statistics will be available? How often do you provide this report? And mainly because right here we're looking at the document in regards to the age and showing that from 20 to 39 years old, percentage of deaths, well, we have 0, but we have 34. It's just a matter of how can I best explain to the Latino community that most of the cases have been in the younger Latino population, just to kind of be able to support this and make a stronger message.
So our data comes out on Tuesday mornings and Friday mornings. It's when we will be getting that specific data out. So you'll have another set of data by tomorrow morning. And we'll be happy to help you frame up the specific language for the Latinos. We'll be happy to have a conversation with you about that and help get the language in a way that you think would be most helpful for them to hear. So,
thank you.
So Rocio,
Absolutely.
when we get the data for tomorrow, I'll send it out to you, and then you can have a conversation with Gibby about how you want to see that data differently or sliced differently so that we can push it out.
Thank you. I appreciate it.
Hey, Dina, this is Mark. One final thought. I really want us to distinguish between our outreach in our Latino communities, but distinguish between our undocumented. I think we really need to make sure that the undocumented community understands that they can get tested, and that spans beyond just our Hispanic or Latino population. And I think it's really, really important for us to focus on that group.
Okay, that's great. Again, I think that's something we can talk to Jennifer at Ray Ward about in terms of messaging and what's the best way to get that out. But I think that's another important message, and we can include that in the conversation.
Janelle Causwell is another good resource as well, Dina.
Janelle Causwell?
Yeah, I'll shoot you her information.
Okay, got it. All right, great. Well, thank you, everybody, for such a great meeting. I always appreciate getting together. Your feedback's really helpful, and I think it helps frame how we move forward from here. And so we'll continue our work, and we'll be back with you all. Have a great day, everybody. Thanks.
Thank you, Dina.
Thank you, Dina.
Thank you, Dina.
Thank you so much.
Good session, Dina.